My name is Abdullahi Ibrahim Umar from Kalinga University in Areful, Chhattisgarh, Indian. Faculty of Pharmacy. I'm here to presenting my first presentation about typhoid disease. That is management, control, and prevention of typhoid disease. First of all, when you say typhoid, what is typhoid? Typhoid is a water and foodborne disease caused by bacteria called Salmonella typhi that change the physiological functions of the body. When you see my paper presentation here, you have seen how the change of physiological functions of the body. When you see the bacteria, this structure of this bacteria, that is Salmonella bacteria, how you see this human after drinking this water, how you see change of physiological functions of our body, that is abdominal pain, fever, loss of appetite, vomiting, due to the contaminated of these microorganisms. So that is all we call what? Symptoms. After you have seen the symptoms, what is next about? This is we go for the management of the typhoid disease. When we start the management of the typhoid disease, we have to start with what? Diagnosis. When you start with the diagnosis, we have to go for Widal test. If you start with the Widal test, if it is positive, we have to go for what? Treatment. When we start the treatment of the typhoid, we have used antibiotic, antipyretic. When we start with antibiotic, there is different class of antibiotic that we use for the treatment of the typhoid disease. We have ciprofloxacin, we have amoxicillin, we have augmentin, we have ceftriaxone, we have sulfonamide and chloramphenicol. But augmentin, it is what? Combination of carbonic acid and amoxicillin. Due to the increased potency of the amoxicillin, the medicine will be more effective and against these bacteria. But especially in use of antibiotic, we have to be careful, especially medical doctors, nurses and pharmacists, because you have to treat this typhoid based on what? Severity of the conditions, due to the avoid the resistance of the antimicrobial drug. Especially, we have to start with this initial drug before we start with what? Higher drug. That is, we call it as initial treatment. And we have to use what? Another antipyretic, that is paracetamol. After we use paracetamol, that is, we complete the what? Treatment of the typhoid. We have to go for what? Control of the typhoid disease. When we start the control of the typhoid disease, we have to this is environmental sanitation. It's a very, very important environmental sanitation, because any environmental sanitation, there is some hazard, pollutant in environment. So you have to clean the environment very neat. After this, we have to what? Government broadcaster and guideline. That is, government broadcaster and guideline is like a media or some television supposed to government awareness the district people and rural people to protect themselves from typhoid disease. Next is what? Agricultural contamination. Supposed to protect our agricultural contaminated water flow our farm. That is very, very important. Also, next is what? A better healthcare service. That is like medical doctors supposed to be good and effective professional medical doctor and nurses and good professional pharmacists and other healthcare. So we have to go for prevention of the typhoid. When we start the prevention of the typhoid disease, we have to administration vaccine to what? Vulnerable patient. That is we call TB vaccine. It's a very, very important. We have to use typhoid vaccine. It is very important for prevention of the typhoid disease. Also, we have to avoid intake unprostrated milk. This unprostrated milk is a very, very general. It is increase the activities of the typhoid disease. Also, we have to ensure properly cooking food. It's a very, very important. This properly cooking food, and wash hand with medicated soap. You have to wash your hand with medicated soap before you take any food or something like you eat in your mouth. You have to wash your hand very neat. After this, wash fruit and vegetable properly. We have to wash fruit and vegetable properly, because like a apple or some mango, if you want to take in your mouth, you're supposed to wash it properly. It is very, very important. Also any vegetable before you eat. Next, we have to typhoid have another complications, especially typhoid. It is attack intestine. It is very, very, very implications. It is attack our intestine. That is, there is serious abdominal pain through typhoid disease. It's a very, very implication. Due to this intestine attack, there is tendency of what? Internal bleeding, that I'm saying. Due to this internal bleeding, there is some condition occur, especially like heart disease, pneumonia, kidney disease, and psychotic issue like hallucinations. It is so typhoid is a very, very dangerous and it's a very risk disease. So also due to the attacking intestine, maybe there is tendency of a surgery, especially there is tendency of surgery due to the attacking the intestine. So typhoid, we have to try protect ourselves from typhoid disease. It's a very, very complicated disease. So also conclusion, typhoid is a food and waterborne disease caused by what? Bacteria Salmonella typhi. Treatment involves antibiotic and antipyretic. That is properly environmental sanitation, regularly hand wash, and supply purifying water. It is used for control of the typhoid disease. That is very, very important. Supposed to follow this instruction. Thank you very much. I hope my presentation it is well recognized to you. My name is Abdullahi Ibrahim Umar, that I'm saying to you before. Thank you very much.